Welcome to Chapter 7, and this is going to be one of our pharmacology lectures. I bet you thought you were going to get out of listening to my dull, boring voice, but however, here I am, and I'm going to be going over drug forms with you. And drugs come in many different forms. There's For the AEMT, though, there's 7 different forms that I want you to be familiar with. And that's going to be solid drugs, liquid drugs, metered dose inhalers, topical medications, transcutaneous medications, gels, and gases. So we're going to go over those each one here shortly, and then we'll move on to our next topic. So the form of medication, that's decided by the manufacturer or whoever's developing the drug, to make sure that it is the best way to get to whatever it's targeting. So, for instance, if you're targeting cardiac muscle and you need it to get there within a rapid pace, it may need to be an IV route. Whereas if it's something that you're taking on a daily basis to maintain your blood pressure, it may be a PO route or the by mouth. So the drug form should be chosen due to the proper route, the timing of release, and the effects on the target organ. So solid drugs, those we're all probably familiar with that. I'm sure all of us have probably had a headache or a muscle ache or something at some point and had to take ibuprofen, and that is typically our solid drug. These are given by mouth to adult patients in tablet or capsule form. And as an AMT, you may also administer some pills as part of your scope of practice. Even though the drugs that we go over here, you are able to administer over-the-counter medications as approved by your medical director. So, for instance, let's say you have a patient having an allergic reaction, you could actually give them oxygen, you could start an IV on them, you could give them epinephrine through a IM injection, and you could give them Benadryl by mouth. You could also give them maybe a Tagamet or something as well. So another solid form is suppositories, and we're not going to be administering that as an EMT. But just so that you know, just for your knowledge, suppositories are the per rectum route, which is PR, is a very good route of uptake of medications. That's when we have the suppository route. So next is liquid drugs. These are solutions that can be given almost any route. We have suspensions, elixirs, syrups, and emulsions. The suspensions there, if unfortunately I can't get that graphic to work. Well, I'm trying to get it to work, but it just doesn't want to work. So what a suspension is, this is where they've taken a substance that they're wanting to administer to a patient and it's ground in real fine particles and put into a liquid. And whenever you have a suspension, you have to shake it because those particles are heavier than the liquid that it's in generally, and over time it will settle to the bottom. So you'll need to shake it up. And one thing that you may administer as an EMT that is in the form of a suspension is activated charcoal. Now, metered dose inhalers, this is something that as an EMT you could assist with. And here we can also utilize them as AEMTs. And it's a miniature spray canister, and it's used to direct medication through the mouth into the lungs, like albuterol or Combivent or Atrovent. And this, you're going to shake it vigorously, and you're going to give it. Now, we'll go over the actual steps and giving it in the next chapter, but just remember, it must be shaken because a lot of times, and people don't realize this, but some of these are actually a powder, and that powder can settle to the bottom. Your topical and transcutaneous medications, this is applied to the surface of the skin, and that could be an over-the-counter medication that you could administer, like antibiotic ointment or something like that. Or one thing that you may come into play with is that you may end up transporting a patient that has a transcutaneous or topical medication applied to them in the form of like nitroglycerin or as in the form of fentanyl for pain management. Now, one thing I want to say about the topical and transcutaneous routes is that they're usually slow, but usually prolonged over time, so you're able to see a longer effect. Gels and gases, our gels that we commonly come in contact with is going to be oral glucose, which we can administer. And remember, we administer that in the buccal route. And then we have gases, which is oxygen or nitrous oxide. And as an AMT, you are able to administer nitrous oxide. So let's talk a little bit about routes of administration. The route of drug administration affects the rate at which the onset of action occurs. So the choice of the route of administration is crucial in determining the suitability of the drug. So you would not want to take a suspension per se and push through the IV route, which there are some that we do, that we may. We have to reconstitute like certain steroids or even glucagon. So internal drugs, these are administered on any portion of the gastrointestinal tract. So this is the oral route, or as you'll hear say, PO. Now this absorption can take up to an hour to occur. And then there's the per rectum, which is PR. So none of the AEMT medications are administered rectally, but the paramedic that you could be working with may administer some rectally. Some include like Valium or Versed can go rectally as well for a pediatric seizure. So the parenteral drugs, those are going to go any other route, and that includes your IV injections, which is your fastest delivery method, IO, which is very fast too, sub-Q, and intramuscular injection routes. And as an AEMT, you'll be able to utilize all of those on certain medications. And here we just have a form that kind of shows the rate. And I've got some other forms of administration here, which are the sublingual, which you'll administer nitroglycerin, buccal, which is the oral glucose, transcutaneous, intranasal, which some of our medications like Narcan you can administer intranasally, and then inhalation, which is your albuterol, Atrovents, and Xopanexes. But if you can see here, you got the enteral routes, which is per rectum, which is rapid, and then injection, which is for your oral, or ingestion, which is your oral route, is slow. And your parental IV is immediate, interosseous is immediate, subcutaneous is slow, intermuscular is moderate speed, inhalation is rapid, sublingual is rapid, and transcutaneous is slow. Well, that does it for this section of the lecture. Please stand by, and we'll have one more section after this. And as always, if you have any questions, please just let me know.